Welcome to Talk Mental Health with Logan Noon. Today I have on Chris Walker. He's a first-year medical student. He's going to be talking about how he lives with ADHD, and he also manages to be a successful medical student in the midst of being a dad with 2 kids. So he certainly has an interesting story. I think you guys are going to enjoy this one. Chris Walker, first year. I start every podcast off with a cheers. Cheers, sir. Studio Day, Glenmore Green. The Palm Springs of Washington, gorgeous Yakima, Washington. You are from Natchez, town right over to the west. Born and raised, really, forever?
Yeah. Born in Yakima and then grew up my whole life in Natchez.
And then, but college in Idaho, and then immediately after college, did you move right back to Yakima?
No. So, first 2 years out of high school, I went and played baseball at a junior college in Moses Lake called Big Bend.
Oh, okay.
And then went there.
What position?
I played third base and pitched a little bit while I was there. Yeah, played 2 years there, and then I transferred to Lewis Clark State in Lewiston, Idaho.
Did you get to play there as well?
I went there for baseball.
That's dope, man.
Yeah, so then I played 1 year there, and then found out I was having a baby and stuff. So then, cut
priorities.
Life
happened. Yeah, babies before baseball.
Yes,
you made the right choice.
Yes.
Yeah, absolutely. Well, good, man. Well, I was a baseball player too, actually, growing up. Looking back, I wish I tried out maybe for a college team, but I don't think I was that good. I was that asshole on the team, that I was extremely good at hitting, but I was terrible at fielding.
No, that's me too.
Okay, yeah. So, I played anywhere from right field to first base, once in a while third base, but, my errors would just rack up quickly.
Yeah.
They tried me at catcher because I'm kind of like a pudgy dude, and they thought, I could do it, but I was just a terrible catcher. So I DH'd really most of the time, and I would just screw around on the bench and have a good time. But that's cool, man, that you played so much in school. I knew you played a little bit, but that's awesome.
Yeah. I was kind of the same way, though. I played, third while I was going to my JUCO and stuff, and then once I got started playing at a little higher level.
Better program.
Yeah, they were like, maybe we got some better third basemen than you. So, you can go play some right field and just, focus on hitting.
They're like, why don't you go lift some weights and just work on your swing?
Yeah. That was basically it.
Yeah.
And then, of course, every outfielder on our team that year, I'm pretty sure, got drafted and stuff. So
shit.
Yeah, so I didn't get to play a whole ton. I, DH'd a few games and stuff, and then, I don't know, I came in late in games and stuff when we were up. Our team was badass, though. We were I think we were 55-7, and we were ranked number one in the nation the whole year and stuff. And so our team was pretty sick, but and it was cool to be a part of it, but I didn't play a whole ton on that team.
And I think it speaks to my baseball talent. I've never been on a winning baseball team.
Really?
And it's been very odd because, even from Little League, when you're split up in between a million different teams, for some reason I got drafted to this team, and I'm a big Red Sox fan. I was drafted to the damn Yankees, of course. So I had to wear a Yankees hat through, age 4th grade through 7th grade or whatever. Lost every single one of those seasons. And then I think it was the nature of my school that I grew up in. It was a very small school, and most of our athletes were 3-sport athletes. Mm-hmm. So I played soccer, basketball, and baseball. So by the time baseball came around, we were all super burned out of caring, and we would kind of dick around a lot in practice. Yeah. Maybe sneak a few beers onto the practice.
No way.
That never happened. Whatever. Their outfield can be sometimes boring in batting practice. It is what it is. So we were always quite terrible, and we got excited if we made the playoffs. It was that kind of team. But so I digress. Let's get back to the conversation at hand here. So, sir, congratulations on finishing 1 semester of medical school.
Thank you.
I personally think, I've only finished 3, but I still think the first semester is easily the hardest out of all of them. And it's kind of weird because I don't think the courses are necessarily the hardest, but really just the transition into medical school is absolutely, at least for me, it was very, very challenging. So, how was your first semester?
It was tough. Like we were kind of talking about a little bit before, Sci-Pharm is obviously a beast. Everyone thinks that's the hardest one to get through. And
Sci-Pharm for the listeners is our intro to medicine course, biochem, kind of all the basic science nitty-gritty of everything.
Yeah. And so for me, I was a science major, just like finished up my biology degree last spring. And so I just finished a lot of these classes. And so, you know, it was kind of review again. And so a lot of the coursework wasn't necessarily that like new or challenging, but just like the overall, you know, how much of it we got. I think in 12 weeks we got like 70 some lectures or something like that.
Yeah.
It's insane. So like the amount of it is tough. Mixed in with farm, mixed in with anatomy, OPP, family med, like those are obviously, you know, not difficult.
Not as challenging, but
still just like mixed in with everything else, it's kind of, I don't know, makes it challenging.
Yeah.
I definitely thought, though, farm for me was like the hardest class that we had, just because, I mean, you have like no science background for any of it. You're just like thrown like freaking, I don't know how many drugs. Like I think on the antibiotic farm test that we had, maybe like the third one, we had like 200 drugs on it or something like that.
Oh yeah.
That we had to know. And then of course Dr. Elliott is asking like fourth order questions on everything. Yeah. So it's like, how the hell are we even supposed to know any of this unless you watch like Sketchy nonstop? And I don't know. I hadn't really got into Sketchy yet, so.
Okay.
But yeah, so definitely I think this first semester was tough.
Okay.
With the sheer volume of everything.
Yeah.
And but yeah, I don't know. It went pretty well. Haven't failed out yet, so I'm still here.
Dude, there you go,
man.
I
know. That's like.
And well, my piece of advice I think for you and other first years, you know, not just even at PNWU, is I do think the first semester of medical school is the hardest. I think, though, that the courses coming up are actually significantly harder than what you just took, but you're much more able to handle that kind of load. You know what to expect. You know how to study. You've developed certain techniques on how to handle this craziness. And also, you know, even a social component. You've started to develop your friends and,
absolutely.
who you can talk to about these kind of crazy stressors. Because one thing that I sometimes struggle with is, like, even with my wife, like describing what it's like to have a big test tomorrow. And to her, she's kind of like, well, you always have tests. Like, what's the big deal kind of thing. But like, I still have a mini freak out, it seems like, before every single test kind of thing. So can you tell the listeners, this is kind of a two-part question, kind of like one time throughout this medical school semester where you had an awesome triumph where you did much better on something than you ever anticipated, and then on the flip side, can you tell us maybe about one time that you really bombed the crap out of something and you were like, oh my god, like I don't deserve to be here kind of thing?
Yeah. Man, where I really had a great triumph. I think my last anatomy test, I'll go back to where I bombed the crap out of everything. So my second Hell Week.
Okay.
The Hell Weeks. For the listeners, if you don't know what it is, you basically have a test in every class in like 5 days. So it's like 7 tests, like all back to back. Mm-hmm. And so for me, I'm really bad at prioritizing everything that I have. And so like the first thing coming up, you know, I'll study really hard for, do well on that. And then by the end of the week, you know, I'm just having a day to study for each thing. So then, you know, I think we had like farm and anatomy at the end of that week. And I was trying to just like study like just a day for those tests. And I'm pretty sure I got like maybe a 60% in farm or something. I like failed it. And I had never really failed the test before. And I was like, oh my God, like, it's like, what am I doing? And then I took anatomy, or maybe it was the other way around. Yeah. But like, I failed. Like,
it's all over.
I don't even know. Yeah. It's over with.
Yeah.
But I like failed like farm and anatomy back to back, and I was like, oh my God, what am I doing? You know, and I had never really failed the test before. I've always been like a pretty good test taker and stuff. But you know, I like failed the crap out of them, and I was like, shit, like, what am I gonna do now?
Yeah.
So then, you know, and I wasn't like necessarily like close to like failing the classes or anything, but I still had to like reevaluate, you know, try and like figure out what I need to do different the next time around and everything like that. And so then I'd say my like greatest triumph this semester was the next anatomy test, which is the thorax one.
Okay.
And that was, I think, one of our classes like lower test averages too, but I like did pretty well on it.
Yeah.
I got I got like a 90 on it, I think, and I studied really hard for it and stuff, and it was like big for me to prove to myself again that I could like study for something and like do well on it. Just because I was like, at that point I was like, fuck, I think I'm gonna like fail like every test from now on. But then like studying hard and doing well on a test, that was like super big for me. So did you ever have?
Because what I really think of first semester med school is quote unquote imposter syndrome. So what was your experience with imposter syndrome?
I think from like the first day.
Yeah.
Just being in there, because I'd never been around this many smart people before, like my expectations going into med school was like, oh, they're gonna be smart people, but they'll be, I don't know. I think I'll be able to fit in and stuff. And then, as soon as you get to school, you start hearing everyone talk about like all this research they've done and, all their master's programs and stuff like that. And I was like, shit, I don't have any of that. I don't know what you guys are talking about. And so I guess just like from the very start, I just was like, man, I don't really fit in here.
Yeah.
But I think as it's went on and stuff, like, and you get to know people and, I don't know. I've just kind of gotten over it, and I'm like, maybe they'll go be like neurosurgeons or something like that. Like, good for them, but I don't know. I'm still here.
No, certainly.
Yeah, I'm just gonna fake it till I make it, I guess.
No, that's absolutely. And I think like failure isn't always necessarily a bad thing, and like for I guess listeners who listen all the time, they probably get annoyed because I say this all the time, but. Adversity, I look at it as the same way as building a muscle. Like, the more that you go through adversity, like, it is very hard and very challenging, but it is going to make you a stronger person at the end of the day, and in many ways, a better doctor. So I think it's actually a good thing that you did struggle through those certain classes in medical school and that you went through. And then I had kind of similar experiences. Like, I remember there was one vivid point where I was failing both sci-pharm and anatomy by a very healthy margin. And I was just freaking out. I remember my advisor, Dr. Lyons, called me in. I wish I could do a good Irish accent, but he was just like, Logan, you need to study your amino acids more. And he really just he didn't really give me any amazing advice, but he kind of just like, dude, you got to step it up because you realize like you're failing 2 courses, and if you fail 2 courses at the same time, boom, you're gone, kid. Yeah. And so I remember just freaking out and just having a quote unquote imposter syndrome. I don't deserve to be here. In some ways, though, I don't think that's necessarily a bad thing, because that anxiety, that fear of failing out, it did motivate me to really evaluate what I was doing, how I could change, how I could improve. I remember, that's really when I signed up for a tutor. That's when I started using that Anki software, quote unquote, so much. And really I started using a lot of external resources besides just the ones that the school gave me, because I don't know what kind of learner you really are, but I do very bad with a high volume of reading.
Oh yeah, dude. I can't. I like, if I read something, I don't remember any of it, honestly.
I'm very, very similar, and I found that I think it's because I probably grew up watching too much TV.
Dude. Same. I feel you.
I like watching videos, and like sketchy, those stupid little cartoons do stick with me so much more than reading a passage. And so now I've just learned to kind of flip my studying, where I use the external resources first to give me that baseline understanding, and then I use the school's kind of supplemental resources and trying to learning from these CILs and the these experts that are teaching us to teach us these details that they think are most important. But to at least learn the baseline knowledge, I'm not going to learn from a 40-page packet.
Dude, same. Yeah, I think Dr. Brady gave us a packet. I think it was on like osteoarthritis or something like that. It was literally just like copy pasted from Up to Date.
Yeah.
And I was like, I'm not going to remember any of those 40 pages if I read them.
No.
And so I was like, okay, I'm going to go to a CIL. I'm going to do, I'll figure out what's in it, watch like some freaking Boards and Beyond, Pathoma, do some Anki flashcards and call it good. And I'm like, I think I'll be able to get enough from that. But yeah, reading that much, doesn't do it for me. But,
no, certainly not, man. Well,
it's a lot.
I kind of now want to get into explaining to the listeners, we both had our struggles through medical school, whatever. But I think, I really want to explain to the listeners, I can think of 2 particular reasons why you have more challenges maybe than some other people. The first being, I remember it was like the second week of school, and it was one of the reasons that I was so impressed with you. You came up to me and you were like, dude, Logan, like, I've listened to your podcast. I think it's so cool that you're doing this. Like, I live with ADHD, and, I take meds sometimes. Sometimes I feel I don't like them, yada, 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 and I want you to explain this further. But I remember being so impressed with that. But then the further I got to know you, I became actually even further impressed with your accomplishments, because I learned that, you are someone right now who is a parent of 2 kids, and, I know you're a good father, and you really, really care about those kids, and you have to juggle both medical school, being a parent, and also being a parent who shares custody with, the mother. And that is I think an even greater challenge than being ADHD. Mm-hmm. So let's kind of break this down one at a time. So I guess let's start with ADHD. So when were you diagnosed with ADHD? 2
summers ago when I was studying for the MCAT, actually.
Okay.
Yeah, so I was like having a really hard time just studying for the MCAT because I didn't want to.
And at this point, studying for the MCAT, were you a junior in college?
I mean, so like technically I was a junior. It took me a few extra years to finish.
Whatever. So you were in undergrad.
Yeah, I was still in undergrad. I had just like switched my major from kinesiology to biology.
Jesus. Woo. The coaster, baby.
Going flying.
Yeah.
Yeah, and so I was like, I had taken most of the science classes I needed and everything, and I was like, I'll just study on my own. So I bought like exam cracker books to study for the MCAT and was gonna like try and follow their schedule.
Okay.
To study and everything like that, and I had like this whole schedule lined out that I needed to do over the summer in order to get my studying done for it. And I'd like go sit down, and I needed to kind of hold myself accountable and stuff. And when I'd go to study, like I wouldn't get anything done really. Like I'd go sit down, I'd like read the same thing over like 5 times. Like I don't remember any of that. And
I guess describe that feeling. Like, was your mind racing? Like, could you just quote unquote not focus at all?
Dude, I just couldn't focus. Like I would sit down to study, and I was like my mind would just be thinking about everything else going on, and I
like on YouTube and stupid shit like ESPN.
Yeah, kind of like I'm a huge sports fan, so I'm always checking, the Mariners scores and stats, and I play fantasy baseball, fantasy football, so I'd be like checking fantasy baseball stuff all the time.
Yeah.
Like, and it's like I knew I shouldn't be doing it, but I like couldn't stop myself from it, and and I would go, put myself up in this little corner in the library in Lewiston. And I was like, I'm here. I need to be studying. And I just like couldn't make myself study. Or when I did study, like it wouldn't really be that productive and stuff. And so I actually like, was like, this isn't right. This isn't how it should be. Like I do well in my classes and stuff.
But the MCAT is so different than classes.
It's much different. But still at the same time, I was like, I should be able to study.
Yeah.
I should be able to get something done while I'm doing this. And I wasn't really getting anything. I was just getting distracted by everything. And so I went and like, sought out help from my doctor and stuff, and he sent me to a clinical psychologist, and I went through like a whole bunch of testing that summer and stuff, and then they ended up like diagnosing me with ADD and stuff. So, and then thankfully I got meds for that, and that's like helped a ton.
Okay.
But
yeah. So let's kind of now break this apart, I guess. First, I think ADD is probably the most popular, is this the right word I'm looking for? The most significant problem in medical school. It's,
there's so many people that...
Yeah, and I think everyone in our generation has probably some elements of ADHD. Whether it's to a detrimental level is maybe a different... and I also kind of think it depends on what sort of career you're kind of going after.
Absolutely, yeah.
Because I think... if you're not trying to memorize these all random crazy facts, you can maybe live a life without any sort of medication with ADHD just fine and whatever. But, especially when we're doing these MCAT crazy studying, these board crazy studying, whatever it may be, that the medications really do help. Now, did you feel, though, when you were diagnosed, did you feel any shame about being diagnosed ADHD? Did you tell people about your ADHD?
No, I didn't really tell. Like, I was like almost embarrassed to tell my family about it and stuff, just because I had never, complained of it that much before, even though I knew it had been a problem.
And they probably thought you were full of shit because you were probably an A student, I imagine.
Yeah, I'd always done like super well in school.
Yeah.
And I'd actually like talked to my doctor about it before this. Mm-hmm. And, he was like, how are you doing in school and stuff? I'm like, well, I have like a pretty good GPA and stuff. And he's like, you probably don't have it then. And then until I like came to him, I was like, this is a problem. Like this, like I can't focus at all. Until like,
it's kind of like, I know I'm capable of more.
Exactly. And so, my whole, my family and stuff, when I finally like told them about it, they're like, you've always been like super fidgety, like you can never sit still, anything like that. You're always like freaking sidetracked by something. And I'm like, yeah, that's like literally exactly like what ADD kind of is. And so for me to like finally like be like diagnosed with it was like important for me to kind of be like, okay, this like explains a lot about me kind of. Yeah. Because before, everyone was like, oh, you're just, maybe you're just being lazy right now, or maybe you're just being, I don't know, whatever.
Yeah, so, or you want to make it easier for the MCAT, there is a lot of shame about, I think, getting diagnosed ADHD and using medication. And I have this theory, and I want to research this one day, and hopefully I can get somebody to pay for it, because I don't want to pay for it. But, one portion of ADHD is the ability, of course, to get distracted and not be able to focus. But then you can also flip your mind into hyperfocus.
Dude, yes.
And I think you can, at least I think I probably have ADD in some respect, maybe a little bit, at least, whatever. I think we all do. But I think that it's easy to hyperfocus into something that you love. And so what I'm trying to get at here is I think that there could be a correlation between ADHD and being a high-performance athlete. Like Michael Phelps has come out that he has ADHD. I had someone, I believe on episode 4 of the podcast, who was a collegiate football player who had ADHD. And he would talk about how, training for football, playing football games, at those moments of his life, he wasn't distracted. He could focus. Mm-hmm. Did you find that same thing with your baseball career?
I did. Like, definitely like when I get into the moment, when I'm like super focused on stuff, like I definitely do feel like there's like a hyper focus going into it where you're not thinking about anything else. But then I can also think back to times where I was like, would be at baseball practice and my mind would just be elsewhere. And I would be out of it. And so I wish I would have been diagnosed earlier and had meds earlier, honestly, because like it's made such a difference to me. But yeah, definitely I could see, where that hyper focus could be used to your advantage. And like for me, before I was diagnosed, like I wouldn't really study until like the night before things, because once the pressure would be on,
you could focus.
Oh dude. Oh okay. Yeah. And I'm like notorious for it, or I used to be, I'd pull all-nighters all the time.
Did you?
Dude, I've always...
Do you do that now?
Not anymore.
That's good.
Yeah. Not anymore. The start of med school, I was doing it for a little bit, but it was burning me.
Yeah, it's not sustainable. I always try to talk people out of it. I'm like, that is such a bad plan. Please don't do this.
No, yeah, but I had never really failed doing it. I'd always been able to do well on tests and stuff, and so I was like, fuck it, I'll just keep doing it.
And listen, I feel like I know people in second year who still can do it and hack it. Yeah. And hey, those people are the people that I think are going to succeed greatly being an emergency room doctor.
Yeah.
Hey, whatever. If you can do it, fantastic. I can't do it.
Yeah.
I've tried to pull all-nighters, and I've done worse on tests. I turn into a cranky piece of crap, and it's just awful.
Yeah.
Absolutely awful.
So it was that second hell week that I was kind of telling you about when I got real burnt out and failed a couple tests and stuff. So I pulled all-nighters for the first couple tests and, got through them, did great and stuff. And then the last couple I was so worn out. I was like, you got no more motivation to study. I was just burnt out.
Well, and I don't even think it's necessarily a motivation to study, but you're so sleep deprived that you're literally incapable of studying and learning at those
just physically exhausted. And so I was like, something's got to change. And so then this last hell week that we had, I think I slept at least 6 hours, which is a good night's sleep for me.
Yeah, for a med student, 6 hours is very acceptable.
Yeah. So I was like trying to make sure I was sleeping and stuff.
Yeah.
And you know, as long as I am taking like my meds at the right time, then I can get to bed at a normal time and stuff. And
okay.
So
let's you know, being that we're both DO students here, we're osteopaths.
Yes, of course.
You know, pharmacology is not always the answer, and I do strongly believe that. So before we start talking about the meds, did your doctor start to explain maybe any techniques or anything that you could do to improve your focus to start to treat your ADHD before he suggested medication?
No, not necessarily. Okay. I saw an NP actually, and so, and he honestly like didn't seem like he knew a whole lot about ADD.
That's frustrating.
And stuff. Yeah, and so it was a little bit frustrating. Yeah. He was like, you know, you should drink less caffeine. You should, you know, go for walks. Like trying to, you know, tell me to be a little more healthy and stuff. And,
But you were healthy.
Yeah, I'm a healthy, like,
you were a college athlete.
Yeah, like, I still work out all the time. Like, I'm always going on walks with my kids, you know, and there's no way, like, previously that I could have survived without caffeine. So I was like, you know, like, that's honestly probably not going to change. And I don't think that's the problem anyways, because drinking caffeine is, like, the only way I could, like, honestly, like, focus and study and stuff. Well, before. Yeah,
I mean, it makes sense.
Yeah.
It's a stimulant. Yeah.
Yeah, and once I talked to the clinical psychologist too, he's like, you know, he's like, if you're drinking coffee and stuff, that's going to do the same sort of thing as this medication is. Yeah, and so I was like, well, you know, what the fuck's my primary care doc telling me? Yeah. Man? And so that kind of like threw me off a little bit, but yeah, I don't know. Some of the stuff he told me was just like kind of like contradicting, I felt like, and so it was nice to go see like an expert when I saw the clinical psychologist.
Cool.
And he kind of like set things straight a little bit.
And I guess kind of, you know, sort of changing topics real quick here, but was that the first time you had seen a clinical psychologist? Like, have you had any other mental health issues, I guess, growing up? Okay.
No, yeah. I had never really seen, you know, a therapist or a psychologist or anything like that, so it was the first time. Okay,
so you're studying for the MCAT. You finally get diagnosed, you figure this crap out, you start taking meds. What was your experience using, and what meds were you on, and what was your experience?
So it's still, well, I take a little higher dose now, but I started taking Adderall, 20 milligram, instant release. Okay. And the first, you know, they set me up trying to take 2 of them a day, and that was like way too much at the start. Dude, I'd be like fucking like cracked out almost. Really? Not like cracked out, but I would just be focused.
That's not a weird way to necessarily describe it, I feel like, because Adderall is in the class of amphetamines. Yeah, it is, you know, if you're taking too much of that stuff, you're going to get the same as someone who's smoking meth on the street at the end of the day, because it is the same sort of chemical compound.
So, yeah, for like the first, like, I don't know, first couple of days I took like what it was recommended on the bottle and stuff, and then after that I was like, that's way too much.
Oh, really?
And so
so then I describe though, because I've never taken any of these meds, so I don't really understand what were you feeling that you were like, ooh, I don't like this.
I mean, I could focus and it was fantastic, but I was never hungry. Like, ooh. You know, I'd feel like my heart was like beating out of my chest almost.
That's scary.
Yeah, and then when I was around my kids, like I could never like settle down really, and so I didn't like that part of it. Yeah. But you know, when I had to study and stuff, it was great because I could sit down and I could study. I was like, you know, I got to figure out something that's going to be a little more sustainable. So I started breaking up. You know, they gave me 20s, and I'd break them up. You know, like into quarters or into halves, and I would just take either like a quarter or a half at a time. Okay. And just take that, and that was. You know, as long as I ate before and I stayed hydrated, like I would just feel focused, and then, you know, and I would feel good, and I could.
And you were able to be like more present with your kids, I guess, like kind
of. Well, not really like with my kids necessarily, but like because I've never had a problem like with that because you know we just have fun.
You're a good dad,
you know? Yeah. You know, we just have a good time, kind of. But as far as like going to class and stuff, like I would always make sure I took it before class, and I could like pay attention in class finally. And that's
would this be something you would take first thing in the morning?
Well, if I had like an early morning class, I would take it first thing in the morning. But whenever I had class, I'd make sure to take it like half an hour beforehand or something. Okay. Just so that way I could pay attention in class. Okay. And that's one thing I've like never been able to do is go to class and then actually pay attention. Like I've gone to class, but then I've, just fucking sat there on my phone or, bullshitted with someone next to me or something like that.
Yeah.
Like there was, when I went through, I think it was Biology 181, 182, which is like the biology series at my old school. I don't know if I ever even like took a note in either of those classes just because I thought it was like such boring material. And I just couldn't focus in class. And so I would have one of my friends, she took great notes. And literally like, the week before an exam, she would go through all of the lectures that we'd gone through, and we would just like sit in a little study room together where I had to be focused. Like, I couldn't be distracted by anything. And she would teach me basically everything for the test. And then that's like what I would do to study for that class. And so, I should have known then that that's like not sustainable really.
Okay. Well, whatever.
But yeah.
It was at the beginning of all this.
Exactly. And so, so once I started like taking my meds and stuff, I could like sit down, I could actually like focus in class, I could take notes.
And so you obviously did successful on the MCAT. You gained entry to medical school.
I wouldn't necessarily say successful, but good enough.
Dude,
I got in.
The MCAT is behind us.
Dude.
It's successful enough. And hopefully, and there's another one in that cooler down there, buddy. Successful enough. And that's how I kind of look at boards. Like, I want to do successful enough so I can get a psychiatric residency. I mean, that's all I really care about. And then I never want to think about boards again.
I feel you.
So you did fine, whatever. You got into medical school. So you're here. So when, I guess, though, was that transition between, because you said at first, you were sort of feeling this embarrassment about being diagnosed, maybe even embarrassment around taking meds. I don't know if you felt that way, but I've heard other people voicing that opinion. When did you make that transition into being not ashamed by it? Like, I remember you came up to me, I didn't even know your name, and you told me this information.
I don't know. I feel like as last year, as I was going through my undergrad, there's a lot of people in my undergrad too that have the same thing. And one of my professors that I spent a lot of time with, he'd kind of talk to me, and he's like, a lot of brilliant people have, various mental illnesses and stuff, and he's like, and various things that they're going through. So he's like, it's nothing to be ashamed about. It's nothing to be, he's like, it just is what it is. You just got to like work with it. And so after that, I was like, it's like, fuck it,
And you've been the first one in your family that's been?
I had an uncle
who
has like some ADD stuff, but yeah, I mean, nothing that significant.
Okay.
Like, I don't think like he's taken it his whole life or anything like that, but yeah, pretty much like the first one.
Okay. So you just kind of got to this point of being like, screw it. Like,
that's just
did you start telling a lot of people, or did just your intimate friends, or like
okay. Some of my close, like, it's not like I go around being like, oh, I have ADD to everyone, but to my friends, like, they know, like, if they see me like grabbing an Adderall out of my backpack during class or whatever, they're like, oh yeah, Chris just needs to pay attention a little more during this class or something, So.
Well, I remember one of the most, because it was still early. It was early on in the semester. I hadn't been doing the podcast all that long. I guess I still haven't been doing it all that long. But it was such a motivating factor for me, because you came up to me and you were like, dude, I've listened to your podcast. I think it's very cool. I want to be a part of it one day. And like, I live with ADHD. And I was so just floored. And I was like, dude, this is the coolest thing in the world. And you gave me so much motivation to continue with the podcast. So once again, thank you for that. That was really, really cool.
Dude, yeah, thanks for doing the podcast. I love it.
Well, cool. And so now, have you told, like, you're a very popular guy in the first year class and the second year. I feel like you know more second years than I do.
I don't know about that.
Do all of your first year colleagues, I guess, know that you have ADHD?
Probably not.
Okay.
I feel like there's, a fair amount of people that I'm close with that probably know, but I don't think everyone would know. But I've had a lot of people, though, like, approach me and, like, ask me about it and stuff. So, and if they ask me, then I'm pretty open about it. But I've actually been surprised by the amount of people in my own class that have it and, and are taking meds and stuff, because I didn't think it'd be that big of a thing that many people would be taking,
it's huge.
Stuff. Like I had no idea that it affected that many people, but there's like a huge portion of my class that is,
I wish I could put a percentage on it.
I wish we could too.
Yeah, I wish we could like do some kind of questionnaire. I'm willing to bet it's more than half.
It's at least close to half.
Yeah, deal with some sort of elements of this. And, as someone who lives with bipolar disorder, I'm super happy to be open about what I live with. However, I am also, roughly 4% of the population lives with bipolar disorder. So I'm not expecting a ton of people to also have this in my medical school class. But at least with ADHD, I get so excited when people are open to talking about it, just because so many other people live with it.
Yeah.
And so many people are ashamed of it. They maybe they run off to the bathroom to take their medication or whatever. And I just think that's ridiculous. Or they don't want to tell anyone about their taking medication. And it's like, dude, we're studying to be doctors here. Like, shouldn't we almost educate each other about our medical problems?
Yeah.
And I remember one thing that, I've known a lot of people in my medical school class, and I guess you're the first person in the class behind me about ADHD. But I've learned from students who take medication every day at the same time, every single day, and they've been on the same dosage, whatever, for a long time.
Yeah.
Now, I remember you explained to me that some days you choose to take the medication when you feel like you really, you need to up your, essentially, focus ability. And is that a word? Focus ability?
Something like that.
Whatever, hyphen that shit. and other days, you feel like, dude, I don't need this. So I guess right now, are you currently taking your medication at every single day, or do you take it like when you need it? Like, how do you do this?
If I have class or if I'm going to study, I'm always going to take it. But, right now, no, because it's
like, so we're over break right now.
We're on break right now. I haven't taken any over break, and I feel fine with it.
Okay.
I'm obviously a little more tired. I'll just drink an extra cup of coffee or whatever.
Mm-hmm.
But I don't know. If I really need to sit down and focus, then I'll take it. But I'm not a person that's going to take it every single day.
Okay.
Yeah.
And I think it really just it all comes down to like what works best for the person, because there's some people who really like maybe they can't function unless they take it every single day, and just whatever. Now, what do you think about? And I don't mean to offend you here, but I'm going to maybe. It's been described to me by some other people, and I would partially, not in a bad way, but sort of disagree with this, as ADHD medication, in the amphetamines class, the stimulants class, can sort of be synonymous with steroids in baseball. And what I mean by that is a lot of people take these medications who are not prescribed it and who maybe don't have ADHD. And I have really mixed feelings about it. Like, I want people to take medication as they're prescribed.
Mm-hmm.
But I also kind of think about, like, listen, if you're taking this medication and at the end of the day it is helping you be a better studier, who is getting hurt in this situation? Yeah. It's like, you're becoming maybe a better practitioner that's going to be able to help your patients, freaking 7 years from now. But, so I guess, what do you think about this, what I'm describing?
I've had a lot of experiences with that exact thing you're talking about. Like,
Jesus, stupid coaster.
I've had a lot of people ask me for them and stuff, and it's like,
really,
yeah, and
I'm not surprised.
Yeah, and I don't know, like, I get where they're coming from too, because they want an edge or whatever. They want to be able to fucking stay up all night and study, but I guess I kind of get where they're coming from and stuff.
Yeah.
But at the same time, it's like, those of us who are taking it, like, we need to get up to this normal level, where they are probably sitting at, or, people without it are sitting all the time. And we need, the medication to get to that normal level, to function, to study, to focus at the level that they're always at. And so I don't know. It's tough.
Yeah.
Because I guess if it is going to help you be a better doctor one day and, help you study now and help you do better on your tests, it's hard to say, oh, you shouldn't be taking it. But at the same time, it's like, just go, if you really think you need it, go see your fucking doctor and, go talk to him, go tell him.
And I would at least encourage people, like, go take the test that, whatever the test is that is called. I don't even know. Do you know? I don't know.
I don't know. Dude, I had to take like fucking 6 tests.
Yeah.
So.
And I would at least encourage people to take those tests, and please take them, like, honestly.
Yeah.
Like, don't purposely fail.
Exactly.
Like, I know it's probably maybe easy to purposely fail, but whatever. But I do kind of get where people are coming from who don't have ADHD that are tempted to take this medication, because I'm one of those people.
Yeah.
When I sit down to study, for me, I'm a sports fan, but, like, I'm a little bit more loose. I fully accept that I'm a bandwagon fan. I'm from the Boston area, so it's easy for me. We always win championships.
Yeah,
so I just kind of hop in the playoffs. And I'm like, oh yeah, we're in the playoffs again. Like, this is fantastic. So I'm one of those assholes.
Meanwhile, me over here, I'm a Mariners fan. We haven't been to the playoffs.
I know. I mean, you haven't been good since Ken Griffey. It's fantastic. And
it's
so
awful.
I'm one of those guys. But really, so that's not really my big distraction when I study. But man, dude, I could watch videos on cars and skiing till I die.
Oh, yeah.
And, like, I just love cars. I mean, a big part of my problem when I'm, as someone with bipolar disorder, is I spent way too much money on cars. Like, I wish when I take out an auto loan that there's like a check, like, do you have bipolar disorder? Like there really should be that kind of check, because I should not be allowed to get an auto loan, because I just love cars so much and I will go broke on cars. And thankfully I'm married. I think my wife will help out a lot with this, but I absolutely love cars. I want to be a race car driver one day. And I think that's a big driver as why I want to be a doctor, to fund my race car career. But, so I digress. I clearly have a problem with focusing sometimes. And so I'm very tempted to sometimes use, but I haven't used, but I think a lot about, like, what am I capable of if I did ever use ADHD medication? Mm-hmm. And, I'm not going to lie, I sometimes feel a little bit envious of people who do get to use it, because I'm like, man, like, maybe I could finally be above the bottom 20% of the class, where I always sit. I love it there, but I wish I could get out of there, But I also think about sometimes the negative side effects of this medication, and what sometimes people have described it to me as, it is a stimulant at the end of the day. And sometimes, like, when I take too much caffeine, it really exacerbates a lot of my anxiety. Mm-hmm. And so I know that, if I do get on Adderall or Ritalin or whatever it may be, I've had issues with anxiety in the past. I've had issues with insomnia in the past, and I know it could really make a lot of those worse. Yeah. So that's really what I think a lot about when I do get those feelings of maybe envy or whatever it may be. So have you ever had any negative experiences with these meds?
Like I was kind of saying at the start when I was taking them, I did actually, like, I had a ton of anxiety with it and stuff, especially at the end, because it's a stimulant, so it's gonna bring you up, and then at the end of it you're gonna come back down. And so, especially if you're not eating with it, if you're not staying hydrated, if you're not sleeping, if you're having unhealthy habits and stuff, you're gonna have a lot of side effects from it. And so, like, for me, I gotta make sure I eat before I take it. I gotta make sure I'm, like, drinking a shit ton of water and stuff. Otherwise,
have you ever worked out while taking the medication?
Yeah, it's like, I don't know. It is similar to, like, taking, like, a good pre-workout or something. Okay. Did you ever take Jacked 3D back in the day? It was, like, the best pre-workout of all time.
I don't know if I've taken that particular one, but I have taken pre-workouts before, and I've had, like, heart palpitations.
Yeah, so I'd say it's kind of similar to that. Okay. But, like, I would, have an hour between classes to go work out or whatever, and so I would, go to class, work out real quick, and then while you're working out, you're in the fucking zone. You feel great, and I don't know. So it does, I guess, make you work out a little better, but at the same time, The main thing for me that I notice if I'm like not like eating beforehand and like drinking enough water and stuff is my heart rate gets like so high from it.
Have you ever measured it?
I mean, I've like been measured when we're doing like family med stuff.
Yeah.
And it's like never like extremely high. It's never to like an unhealthy range and stuff. But I know like sometimes like just like feeling my own heart rate, I'm like, holy shit. You
just
know,
higher than normal.
Yeah, I need to, you know, chill out just a little bit. But
yeah. So I guess now, you know, we're gonna be DOs one day. So let's keep rolling this back to being DOs. So we've talked a lot about meds. So what lessons though have you learned, and what lessons could you advise to other students dealing with just focus problems, whether or not they have ADHD or not? You know, outside of medication, what have you learned about that can help you with what has helped you with your focus?
I think just like taking it at the proper times and stuff, and
like, but not the meds. I'm saying,
like,
what have you done in your life to help with your focus?
That's hard because I got a lot of shit going on. I feel like, you know, that it is hard sometimes to focus. But things for me, like I was telling you before, I used to stay up all night and I'd have to wait till the pressure was on me to study. And I, you know, unless I could count down on like 2 hands how many hours till the test, you know, that'd be like the only time I could focus before a test. And now, you know, like I make sure I'm like studying, you know, at least a week beforehand, like starting to like review stuff and seeing stuff. And I guess just like giving myself enough time to study. That's been helping me quite a bit. And I don't know. Well, there's a lot of shit like, you know, the meds definitely like help.
Hey,
with
listen,
it,
if they're working, you know, if they're getting the job done, you know, hey, maybe you don't need supplemental tools.
Yeah.
So I think I'll answer them my own question.
Yeah, let's hear it.
Because, you know, I think if I were to take those medications, I think maybe, yes, it could have a beneficial effect on my focus. But man, dude, I do have bad anxiety. I do have bad insomnia. And so I'm scared to take the medication because of that. Yeah. So I've really had to develop tools to help with my focus because I know I'm scatterbrained sometimes and I know my mind just can race. So first thing, and I remember watching this on a YouTube video when I was actually studying for the MCAT, same kind of thing. I forget exactly what the name of it is. But so what I do is I'm a big fan of timers. And so I try to almost accept my, you know, inability to focus as what it is. And so I'll set a timer for about 15 to 20 minutes where I say, okay, listen, I am going to put my absolute all into focusing right now. It's only going to be 15 or 20 minutes. Like, it's going to feel like eventually a really long time, but I'm not going to check Instagram. I'm not going to check YouTube or Facebook. I'm not going to get distracted with any of that stuff. I'm just going to focus. Once that 20 minutes go by, I'll give myself 5 to 10 minutes. Same thing, I'll set a timer of scatterbrain. I'll go watch a YouTube video on a new McLaren F1, you know, or a new WRX. What mods to a WRX produce the most horsepower, you know, kind of thing. And like, I'll get really into that and I'll love it. And once that 5 to 10 minutes is up, boom, I set another 20 minutes of focus time. And so that really helped me out. It helped me really get a lot more done and be more efficient with my time. And then also still kind of enjoy myself and enjoy my studies, because if I try to study for, you know, 2 or 3 hours straight, I lose my mind. It's terrible. The second thing is I'm a big fan of meditation.
Dude.
Do you meditate?
No, I want to get into meditating.
Dude, you need to get into meditation. I'll send you a few links. Yeah.
Teach me.
Well, you know, I think YouTube and guided meditation is the way to start. And there's some apps that I like Sam Harris just came out with a new meditation app.
Like the singer Sam Harris?
The singer Sam
Isn't
Harris.
He Sam
the
Harris?
Neurologist Sam Harris?
different Sam Harris.
How dare you?
Different Sam Harris.
And then there's 10% Happier, there's Calm, but really I think at the end of the day, if you just Google mindful meditation, and especially on YouTube, mindful meditation, Jon Kabat-Zinn, and I'm not talking about meditating for 2 hours at a time here. I'm talking about meditating for 10 minutes. And I think it's better to meditate 10 minutes every single day versus meditating once a week for an hour. And meditation really has helped me. It's helped me with my studies, but it's really helped me, I think, mostly with test taking, actually. Because I don't know what your experiences are, but, 2 hours into a test, I'll read a question and I'll be like, what is this even about again? And so I'll literally, if I have enough time right then, I will close my eyes and count to 100. And I typically won't even get there, but I'll just try to get focused on the moment. I'll focus on my breathing, and then I'll dive back in. And I know it's because of the meditation practices that I do, and I don't do them every day, but, I'm trying to get better at this. But that's really helped out with my focus. Uh-huh. The last thing, and I know you're already doing this, is, when I feel my brain scatterbrained and when I try to get into my studies and it's just not working, I'll try to go exhaust my body. I'll try to go exercise. I'll try to go work out. I'll try to go, do something else.
Do something else.
Yeah, just absolutely. And so those are kind of the 3 suggestions that's really helped me kind of with my ADHD kind of thing. So I think now, we have, we're at 50 minutes here. It's midnight. Jesus! It's midnight over here in Yakima, Washington. So I won't hold you too long. I know you gotta get back to your 2 little cute kids. So I guess one thing I think I'm even more impressed with your ability to be successful in medical school with ADHD, because I know so many other students that are successful with ADHD, is your ability to be successful being a parent. And also a parent who has to juggle I know you drop your kids off in Portland and share custody with their mother. So I guess how have you managed that crazy balance? And what advice would you give to other people that are dealing with being a parent in medical school?
Well, I guess I don't always drive to Portland. We meet in the Dalles usually.
Hey, don't tone it down, man. You're still managing to be a parent in medical school. Yeah. So, we were joking around before the podcast. One thing that's one of my most favorite things about you is sometimes I'll complain about I have to get the cat's food tonight. Their litter is just, those fucking cats just poop so much. I have to change their litter. And then I look at someone like you, I'm like, oh wow, he is a parent to 2 toddlers and he is holding it together. And it just inspires me so much to be like, nah, dude, you're fine. Handle your business, shut up, stop complaining. You have it so much easier than somebody else.
Dude, that's how I feel though about it. I'm I still feel, I feel blessed where I'm at right now. And so I feel I can't really complain, and I just gotta keep working through it and shit. And yeah, it's hard sometimes, but it's I chose this. This is what I want to be doing. And at the end of the day, I'm so thankful to be at the spot I'm at right now. I was telling my dad this, I think last week. I was or a couple weeks ago when we were getting ready for all these tests and stuff. I was a year ago I would have killed to be in this position that I'm at right now. Yeah, and it's so. I can't really complain, too much about having fucking 9 tests coming up in 10 days or whatever. Yeah. So, I don't know. So, for me, I use my time with my kids, to kind of get away from school and stuff. I try not to study very much on the weekends. And, if I do study, it's, super late at night. Yeah. I'll stay up. I was telling you before, I have no problem staying up till fucking all night if I have to. Yeah. And so.
Well, and I think that really just speaks to, it seems at the end of the day you want to succeed, of course, in medical school, but parenting comes first.
Parenting is, parenting most definitely comes first. And so, yeah, for me, as soon as I get my kids, I'm back into dad mode. And so, for, at least for while I'm in school, I have them, either Thursday night or Friday night through Sunday night. And so it's I can take a break from studying. And I guess I use that also as during the week, Monday through Thursday, to study my ass off to make sure, I'm getting enough done. And then on the weekends, I can kind of relax a little bit. I'll sleep in with my kids. We just go play at the park. We just enjoy our days kind of. And it's nice to have a brain break. Get away from school for a bit, not think about the upcoming test, not think about, everything I have going on in school. Just like focus on my kids. And so I don't know. I think for me, I kind of use it as an advantage, because I have all this extra motivation to get through school and to be successful and stuff. Just so that way I can show my kids, one day. Right now, they might not realize it, but, like eventually they're going to be like, holy shit, like Dad went through some shit like while we were little kids, and, he just did it.
Yeah.
Because that's what he had to do. So I guess that's like kind of,
well,
that's the way I think of it. I'm just like, I just want to set a good example for the kids and stuff, and fuck,
dude,
I'll do the best I can.
That is so cool, and that is so inspiring, and you literally kind of, I think, almost stole the words out of my mouth, because I was going to say, I think it's almost an advantage to you, not academically, but I do think it's an advantage to you balancing being a medical student, being a doctor, just because, listen, you may fail a test. You may have one of your patients die on you. I mean, actually, no, that's definitely going to happen. You're going to have a patient die on you.
Dude, have you thought about that, though? Like, when you have a patient die on you?
All the time.
I mean, dude, what the, like...
However, but I do think it's more
it's
important that you have a philosophy that you're like, I may fail a test in medical school, but I don't want to be a failure as a father.
Yeah.
And that is more important to me, and I'm going to put that first. And totally. I think that's really something that's important, that a lot of medical students and I don't want to, put medical students into a box, but medical students who maybe they're very young, maybe they don't have a spouse, maybe their life is just medical school. So when they do fail a test, they look at their life as a failure. And so I think something like you said, as someone who, you have maybe you failed an anatomy test or whatever it may be, but you are not a failure because you are still providing for your kids. You're still being a great person and being a great role model for them. Yeah. Even though, I know they're very young, maybe they don't fully appreciate what you're doing yet, but they certainly one day will. And so I think that's really awesome. We're coming up on an hour here, man. So you did fantastic, man. There's so many other things I could talk to you about. So we're just gonna have you back on the podcast, man.
Let's do it.
You did fucking awesome. Anything else? Any other pieces of advice that you want to maybe give to the listeners?
Fuck. Nah. I mean, if you got fucking. I guess if you're going through your shit, and you got, you're going through a hard time or whatever, you just got to find out what's important for you, find out what's going to motivate you and stuff. Like, for me, it's my kids. For everyone, it's going to be something different, but you just got to figure out what's, like, driving you and just use that as your fuel and, keep going, keep plugging along, and, you'll make it.
Well, hell yeah, man.
That's all it is.
I mean, I think you gave great pieces of advice on ADHD today and also handling, the craziness of medical school. I think we should do a follow-up, maybe once you finish your first year of medical school.
Yeah, let's do it.
And kind of what that summer is like. I am going to be in Yakima next year, so I will be around. Yeah.
Dude,
yeah, I got a place in Yakima. Hopefully my knee won't be so bummed then, so I'll be able to play a little more ball with you guys, have my old fat ass kind of throw some,
back out there hopping
throw
around.
Some threes around,
Dude, there we go.
Well, cool, man. Cheers. Let's end this. Fantastic. Thank you so much for listening. Be sure to tune in next week. I'll have on Diane Mintz. She is a bipolar disorder advocate, a lot like me. We met about 5 years ago as public speaking training. Geez, we got training. I can barely even talk right now. But we have a great relationship. We had a great conversation on the podcast. So be sure to tune in next Wednesday for Talk Mental Health with Logan Noon. Thank you.